Optimizing Telehealth, the premium resource for evidence-based strategies to enhance telepractice today. Brought to you by the Telebehavioral Health Institute. Enjoy this excerpt from the latest episode. To access the full episode and to get your continuing medical education and continuing education hours, visit us at Telehealth.org.
Welcome. I'm Dr. Marlene Maheu, and I'm here with my co-host today, Dr. Shauna Wright. We are very happy to be bringing you the first in a series of podcasts called Optimizing Telehealth. We'll be focusing on effective strategies for managing Zoom fatigue, and this webcast is focused on evidence-based strategies for telehealth professionals and consumers.
Optimizing Telehealth is brought to you in part by SciBooks, your one-stop shop for telebehavioral health technology. Learn more. Visit them at scibooks.com, PSYBOOKS.com.
Shauna, could you talk about the definition of Zoom fatigue and the contributing factors that you found?
Absolutely. So when we look at Zoom fatigue, we're told that this is really a new phenomenon. And as Marlene and I chat here today, we might learn that maybe it's not so new. But we've heard a lot about it here in the media lately because professions across the board have translated their work to televideo in many different ways. So what we're hearing about Zoom fatigue, it's an overall tiredness. Sometimes there's a worry or an angst that goes into using televideo technology to maintain your workload. We're seeing some reports of burnout associated with the volume of work that's transitioned to televideo communications. So basically, it's that fatigue that people are feeling associated with using virtual platforms for communication. And when we look at, there are so many theories as to where does Zoom fatigue come from. There are some that suggest that there is an auditory component, right? That in in-person communication, the sound and the words that we speak match up with our lips moving they're very in sync. Sometimes there's a delay and we have to do extra processing. There's also some concern that we're missing out on nonverbal communication. And we all know that nonverbal communication is such a huge part of how we communicate with others. But with televideo, we have a limited frame, and sometimes we're trying to figure out those nonverbals without the support of seeing someone in person. So there's some theories that, our cognitive functioning is almost in overdrive sometimes when we're using televideo communications. Also, we might have some visual strain, depending on how bright our screens are or how well lit our room is. We may have visual strain that can contribute to that fatigue. What we're seeing in other professions is that when they have their Zoom screens or their televideo up, they're multitasking. They're not just attending to their meeting, but they're doing things on the side, and that multitasking can be fatiguing. And the other thing that's coming up for healthcare professionals in particular is they're sometimes feeling that they're performing multiple roles. They're the provider and they're also the IT specialist to get their patients and their clients through their appointments. So there's a lot of things that can tax us, definitely, and contribute to the fatigue we feel when we transition to telehealth.
The other side of that too, Shauna, that I'm seeing in talking with a lot of people here in our training institute is that the stimuli that people are being exposed to is rather complex. That creates some sort of jarring effect. They may not know how to properly position their equipment so that all you see, for example, is maybe their nose and their eyes and a fan circulating overhead. And then you're supposed to be having an adult conversation with somebody who's clearly not looking like a normal human being. And so our brains are trying to adjust constantly. And that can lead to a lot of strain for us when we work with people if we don't know how to adjust them and how to have them maybe move their laptop cover or position their phone or whatever they're using. Shauna, would you talk about the evidence to support the idea of Zoom fatigue in the literature?
Absolutely. Now, one of the things I want to point out here is that the Zoom fatigue vernacular, that term, it's really fairly new. And it's because we've jumped on to telehealth and televideo at such a large degree. However, our previous telehealth research, this hasn't come up as a phenomenon. And I think in part that's due to the fact that a lot of the telehealth research we have is very specific. It's time limited, right? Most of our telehealth research comes from professionals that have a balance of in-person and telehealth work. And so when we look at what does the research say about fatigue with technology, we really, to go backwards prior to COVID, we have to look into a lot of the industrial and organizational psychology to look at how does interacting with technology affect our fatigue and our resilience as providers. So we have a few research articles mentioned here, and we're just going to try to generalize from what we've learned prior to COVID. I'm sure there's going to be a lot more research about Zoom fatigue and technology fatigue moving forward, but let's just take a quick look back. If we look at Balsi's work back from 2003, what they did is they looked at workers and they looked at their work rest schedules for workers who did a lot of work through video display terminals, right? And they tried to figure out what is the best work to rest ratio to keep, our workers healthy, because they found that their video display terminal workers had high incidence of musculoskeletal problems, visual fatigue, and just overall job stress. And what they really found is for every 30 minutes that someone is in front of the screen, they should be taking the optimal work rest schedule is 30 minutes on, 5 minutes off, and maybe even building in some microbursts of movement or exercise between those work periods. And I think that's something that's very important for our healthcare and behavioral healthcare professionals to keep in mind, that there does maybe need to be a balance between how long we're in front of that screen and how much of a break we take. And if we look back at Barber's work, they really looked at working in the home, right? Individuals that were doing work through information and communication technology in their homes, and how that exposure to technology could disrupt sleep. And what they found was that the workers who really set firm boundaries in terms of how they used technology and how they used it for work were less likely to have disrupted sleep. So when you're working from home, sometimes our work responsibilities and our home life, they can kind of trend together, and we may not have clear boundaries. And that means we may not be recuperating and getting the rest that we need. So their study found it's very important to have work boundaries, especially in terms of how we're using communications technologies, and that maybe after a certain time of day, we're not answering emails just because we conveniently can, that we're not engaging with video just because we can or we feel like we'll stay caught up, because it can be very disruptive to our sleep cycles. And the last one that I picked here, I was hoping that you'd help me out with a little bit, Marlene. The Kim's research really looked at cupping. And I know that's something that you have taught others to do in terms of self-care. But this study found that those who have that video display terminal as part of their work life really benefited when they engaged in cupping and mild exercise in terms of their overall physical health when they spent several hours a day in front of the screen. Would you mind sharing with us how cupping works? I know we're going to talk about self-care a little bit later, but it's
Sure.
really important because this research pointed out how important it was.
I've done a lot of computer work, and so I've worked on this quite a bit myself. One thing is to look at my monitor and then look out an open window if I have access to an open window, and then back at my monitor and back out. And the further away you can do that, if you have a viewpoint in your house, it's just a good idea to look out the window every now and then and sort of exercise your pupils and, just make those little muscles in there work, because they do get frozen in time, over time. And then you experience eye strain. And if you just work them a little bit, it's like any other muscle, then it just keeps everything lubricated. So the cupping idea is to put your hands over your eyes and lean forward. Put your eyes into your hands and lean forward, and experience your eyeballs, if you can, falling into what you can imagine to be black velvet. Just really, 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 really soft, cushy black space. And you'll find that deeply relaxing to the inside muscles of your eyes. There's those kinds of things. The last one that I do is I close my eyes, and you can do this with me if you'd like. Look up sort of as 12 o'clock on a clock, and go to 1 o'clock and 2 o'clock and 3 o'clock, 4 o'clock, 5 o'clock, 6 o'clock. And as you do that, you go all the way up, back up to 12. If you see that your eyes are sort of jagging down, skipping an hour or two, then you need to work that more. So just keep going back and work that edge, because what's happening is you've got muscles that are kind of taking over in there. You're not doing the full rotation internally with your eyes closed. So these kinds of things you can do to keep your eyes fresh and alive. Okay. Would you talk about what the other options are in addition to what people are calling Zoom fatigue, what other factors might be?
Absolutely. And I know that you were a great mentor to me when I stepped into telehealth, more than a decade ago, because I told you I was feeling this fatigue. It's not new, but I really feel for the providers who are experiencing it right now, because I don't think it's just Zoom fatigue, right? We want to take a step back and look at the whole context. Just universally, we're experiencing maybe pandemic fatigue. So there are a lot of things that we want to look at in terms of why are we fatigued, because we care for ourselves and we adjust to what we need based on what those causal factors are. So we really encourage providers to look at the context. Am I feeling fatigued and taxed in other ways, whether that's financially, workload, stepping into a new area that I've never practiced before? There are so many different levels that can contribute to that. So we encourage you to do a self-assessment. What is causing my stress, my burnout, my fatigue? Being on camera all the time could definitely contribute to that. And that's why Marlene and I are here today to talk you through how to care for yourself and make adjustments. But we also want you to recognize that there might be contextual issues that are compounding that fatigue that paying attention to could definitely benefit you in. And another thing that we really encourage looking at is your screen time fatigue. Once you're done working, how much time are you spending in front of a TV, whether that's television, your phone, a game you might play, and are you giving yourself a break before bed? Most professionals recommend an hour with no screens on before bed so that your brain can settle down and get the restorative sleep that it needs. So yes, maybe it's Zoom fatigue, but we need to do a full assessment and take care of ourselves probably on many different layers.
I'm seeing a question here about moral fatigue. I do want to address this moral fatigue issue because some people haven't heard about it, but it is the experience of having to make a choice, which none of the options are good. And so many of us have gone through that with the pandemic, is what's the lesser of these multiple evils? I have to choose something to go forward, but I don't feel good about any of them. And that does create conflict. And when we sit with that over and over and over again, client after patient after client, it can wear on us. And so now the literature is talking about moral fatigue. If you're interested in that, I encourage you to go look it up.
So Marlene, can you tell us, are there things we can do to prevent or mitigate this technology or Zoom fatigue?
Well, of course, because I run a training institute for telehealth, I need to talk about telehealth training. There are many questions that people come in with that once they get answered, they feel much more comfortable, much more confident and competent in delivering telehealth. So I think people will definitely be fatigued if, for example, they get thrown in the deep end of the pool like Dr. Williams and they don't know how to swim. They never learned how to swim. Other people may have already begun swimming in the shallow end of the pool and need more advanced lessons. But I think what's happened is many people were just forced to do it. We just did a consult for a group that the director of which 700 clinicians in this group, he said we had Scotch taped together our program. We just had to do it. And so we did it. But we know it's not right. And so we need some help to pull things together and make sure the documentation's right and our workflows are appropriate. So that workflow management is crucial too. You may have had the experience of having to deal with colleagues and nobody really knowing what to do or how to do it, and hopefully you figure some of that out. But I want you to know there are many workflows that have already been determined, already been shown by the literature. And because this is an evidence-based discussion, I want you to know that the literature does talk about that, and training will allow you to get that quickly, or you can go look it up in the literature yourself. Okay, either way, I encourage you to find out what other people have done over the years, because telehealth is nothing new. It was started in 1959 in our country, in the United States. So there really aren't too many mysteries about it, but the information about it is not that widespread. And what is out there is a lot of conflicting information that frankly is not too well thought through or isn't evidence-based. It's people's opinions, okay? So the other thing that can really help you is learning how to prepare your client and your patient. Having some skill at what to do if a variety of situations keep coming up for you and surprise you. So you're trying to manage your own visceral reactions to things, but still, maintain your presence with your client on video. These are the things that are hard if you don't know how to go in and say, hey, could you please go put a shirt on? Could you please close that door and lock the door behind you? That kind of thing, where you empower yourself to be in charge of the session. So we have a 3-hour workshop on exactly that at our institute, because many people don't realize there's a lot that we can do to maintain control of our sessions. Also, many people don't have an ergonomic workspace. Their desk is not set up right, their chair's not set up right, and they're straining themselves, and they feel the pressure at the end of the day. And self-care, of course, we've touched on a little bit, but there's a whole lot more related to that as well. So, Shauna, let's talk a little bit more about preferred or optimal telehealth workflows.
You bet. Now we can look at the literature again here for recommendations, but I'm going to tell each and every provider this is individualized, right? So you need to figure out what fits your balance best. How much in-person versus how much telehealth? Do you feel more energetic and able to engage in telehealth early in the day, or is later in the day better for you? So again, that individualized, approach and fitting it to the provider and their sense of energy through the day is really very important. And I think what we're going to find as we continue to go into the future with telehealth is that most providers are going to find that balance between in-person and telehealth care. And typically providers prefer to have a telehealth space. This is when I do my telehealth appointments, so that they're not switching back and forth throughout the day, but they put it together in a space. And when they are on, they feel connected to what they're doing, and not that they're bouncing back and forth. Building in time between sessions to get up and move, to walk, to use the restroom. Very, very important to do some of those just basic self-care in between appointments. And we're going to talk here a little bit about optimizing your record keeping and your documentation. One of the things that I've started doing, we're going to talk about, is contemporaneous charting. But really, what we've seen across the board is telehealth has increased our productivity and our clients' access to treatment, which then, of course, means we're doing an increased amount of paperwork and documentation. So we're going to talk about that in just a minute on how to optimize our record keeping. Now, we want you to pay attention to that. So as we talk about some of those issues, Marlene, we've talked a little bit prior to how to prepare our clients, but can you give us a little more detail? How does preparing our clients for telehealth and orienting them to telehealth help reduce our stress?
Well, the foundation is the informed consent process, so that we know how to discuss it and not just give people a pile of papers to sign, and how we can use that particular document to protect us and our clients and our patients from undue emergencies, because they're not prepared, or we're not prepared. And then routines and expectations, having thorough discussions about that, crisis planning. What are the steps you're going to take before you call me? And here are the steps I'm going to take after you call me in the time of an emergency. So being crystal clear about all of that. And then establishing their space, helping them establish their space, because some people cannot find a place to be alone, and it's very stressful for them. So allowing them to dictate some of that, but also coaching them through it.
And I know you've talked about this, but let's jump in a little bit deeper. How does that professional training prevent fatigue when we connect by telehealth?
Well, a lot of people don't realize that competencies have been developed for this field. Actually, I chair the committee that came up with competencies for telebehavioral health. And by telebehavioral, I mean everything to do with mental health and substance use, which now is considered behavioral health by the U.S. federal government, and the ways that we interact with mainstream healthcare as well. There are a lot of different things that have been identified that people really would do better if they knew that. We have information available for that as part of this training that is in the library that you have along with this course. So there's a folder that you can open up, and you'll see the documents in there. It also includes supervision and consultation, and getting that kind of support when you have a question, and not just going to a colleague who's just figuring it out as well. Because if you don't know it or they don't know it and you're making it up, then there really is not evidence-based care, and it's not professional service delivery. So getting the right information from the right people.
Marlene, what would you have to say about that for those that are mid-career or even later career? Sometimes we don't think about supervision or consultation because we've been practicing so long. How do we get over that hump of seeking consultation or supervision if we feel pretty experienced in what we're doing so far?
I think you have to ask around. Maybe your professional association has a group that's focused on telehealth. You can certainly come to the Institute and you can see what we're doing, but we have a lot of activities that involve the community. So you can see people's names there and you can contact them privately online. You may see somebody's name in a forum that we have here. There may be a number of ways that, if you through the internet, of course, that you reach out to try to find other people that are like-minded. They're trying to learn these things and be responsible just like you.
I mentioned earlier contemporaneous note taking. Now, I will tell you if through televideo you're going to take notes while you're with a patient, tell them what you're doing. So I do contemporaneous notes, but I do it at the beginning and the end of the session. I open up my chart, I do my mini mental status exam, and I type it in and I let my client know, I'm doing this, I make a note of how you're doing so we can follow up at the end. But it's so time saving to do some of your charting and note keeping while your patient is in front of you. Talking with your EHR developers or anyone that does that technology for your documentation to put in dot phrases or smart phrases or check boxes that help you slide through some of the regulations that are required for telehealth documentation can again be very, very life-saving, time-saving, life-saving as well, I guess, if you're seeing a lot of patients. But don't be afraid to have those conversations with those EHR developers and let them know what you need.
So with that, Shauna, let's talk about some of the hardware-software combinations to reduce Zoom fatigue.
We've talked a little bit about the mechanics of that, so I'm going to start with that. But we look at the brightness of your screen. Where are you positioning your speaker and microphone? Everything to make you as comfortable as possible and not overtax your senses is really very important. One of the other things that I really encourage providers to do, especially as some of our first contacts with clients or patients are virtual now, is to really make sure that you have an opportunity to interact in a technological way with your patients that is HIPAA compliant and secure. And so looking at patient portals, I think we're looking at patient portals more and more now as some of those first contacts are happening virtually and online. And that patient portal can give us access to getting that intake paperwork done, to collecting the documentation that we need to authenticate the identity of a patient. So if you're not using the patient portal where you can have back and forth communications and you can collect the paperwork you need, I really encourage you to explore some options there. Other things that we look at, of course, is how large is your screen, what can be seen on it. And now as we back up to those hardware and software combinations, we want you to very wisely pick some of those out so that they're convenient and effective for the provider and have ease of use for the patient. I think you're going to talk about that a little bit more here, Marlene.
We write a blog every week here at the Institute. We have several blogs actually, and one of them that we wrote in July was how to use your TV with just a simple little cable that you can plug into your laptop so that you have a really big screen. Now, there are lots of combinations like that we'd love to talk to you about. But it takes a little bit of time. So we have a blog post and you can read that if you want. You have to go to Telehealth.org/blog for that. And just type in Apple TV, okay, in the little search box.
And as we look at our workflow functions, Marlene, what kind of functions in our world can be managed by an assistant? What have you found there?
There are lots of people that have worked with us at the Institute to try to figure that out because they want to maximize their own clinical time and see if somebody else can help them. And educating consumers prior to meetings is a big one related to that. So you could develop a handout, or you could develop little videos if you're prone to that, or have a discussion that your assistant can have discussions to kind of walk people through it and answer real basic questions about how it operates. Of course, if you have an assistant doing that, then you need to document that you train them and that they've signed a BAA, a Business Associate Agreement for HIPAA. But there are lots of different things that are very, very helpful that you can include them. So I just want to encourage you to start thinking about how to be creative with that. So, Shauna, what about considering the workspace?
So there are lots of things we need to consider, particularly if we're working from home. So I'm going to target if you're working from home because it all applies to a brick and mortar office as well. But we have to pay attention to external factors, particularly if we have housemates that are with us. How do we ensure privacy externally? Do we need to put a sign on the door? Do we need to train the people in our home when to respect that privacy and not enter? If we can we put a lock on our door when we're seeing patients and clients to really avoid any intrusions? The ergonomic factors are hugely important. The size of screen that you pick, the way you position it, the way you position your office materials, what's within your reach, and how comfortable even is your chair. We're going to give you an example of that later. And then, of course, we want to look at technology. We want the technology that we use to be easy to use, easy to understand, and easy to be guided through should we need technical support. So those are really high-level factors that we want to look at to make sure that your telehealth experience is as smooth as possible. And again, lots of resources for that both online and at the Institute. Marlene, we've talked about this a lot, but what are some of your favorite self-care strategies? What do you recommend?
Regular breaks and exercise. There's a tremendous amount of benefit from just getting up out of a chair. And a lot of us don't realize that when we're in practice, we get up regularly. We go to the waiting room, get somebody, or go to a lunchroom and grab something to drink. So when we're seated in front of the monitor all day and we don't do anything but minimal motion, then there can be problems. And Shauna, I remember when you told me about this a decade ago, when you first were getting started, you were getting cramps in your legs. At your age, you were getting cramps in your legs because you were seated there all the time. So getting up, running around outside, I live on a pretty steep hill, just walk up the hill 5 minutes to come back down. There's a 10-minute walk that gets a lot of blood pumping. The idea is to get that blood pumping. And then, of course, monitoring screen time when you're not working. Mindfulness meditation is a trick that I'll be talking about in the next segment here. But there's a lot that can be done to learn to control our own autonomic nervous system and not feel overwhelmed in the face of people who are telling us about their overwhelm. So a few minutes of that, even closing your eyes, even doing that cupping exercise, very slow things to interrupt the constant bombardment to our nervous system. They're very helpful. Also, have professional connections. A lot of us are used to working in offices where you go to the lunchroom, your colleague is there, you've known this person 10, 15, sometimes 30 years, and it's a comfortable thing. It's a fun thing. And we miss that. So we may miss our office mates. I encourage you to set up a time where you can hang out with them. It doesn't have to be an hour. It can be 15 minutes. 15 minutes of a weekly office connect time could really be a lifesaver for you. So see if you can just hang out with some people that you like to meet when you're at the office. And then your vacation, you can make it a stay vacation wherever you live. I happen to live in San Diego, so stay vacations are pretty fun. But go visit the tourist places. Go do something that you otherwise would not do if you were just having a regular weekend. So go try to keep yourself safe, but do something a little more extraordinary.
Thanks for listening to this excerpt from the latest episode of Optimizing Telehealth, your premium resource for evidence-based care. To access the full episode and to get your continuing medical education and continuing education hours, go to optimizingtelehealth.org.